When it comes to maintaining our health, vitamins often come to mind as essential nutrients our bodies need to function properly. Many of us, especially as we get older, are encouraged to take vitamin supplements to fill in any nutritional gaps. We hear about the benefits of vitamins for our bones, our immune system, and even our mood. But while vitamins are important, it's possible to have too much of a good thing. Taking excessive amounts of certain vitamins can actually be harmful to your health, especially for older adults. Today, let's explore 3 vitamins that can be harmful if taken in excess: vitamin A, vitamin D, and vitamin E. Understanding the potential risks can help you make safer, more informed choices about your health. Let's begin with vitamin A. This vitamin is well known for its role in supporting vision, immune function, and the health of our skin and mucous membranes. It's an essential nutrient, and a deficiency can lead to serious health problems. But vitamin A is also a fat-soluble vitamin, which means that instead of being flushed out in your urine if you take too much, it gets stored in your liver and body fat. Over time, if you take high doses, especially from supplements or certain medications, vitamin A can build up to toxic levels. Vitamin A toxicity, also known as hypervitaminosis A, can cause a range of symptoms. In the early stages, you might notice nausea, headache, dizziness, or blurred vision. Over the long term, too much vitamin A can lead to more severe problems, such as bone pain, joint pain, dry and peeling skin, and even liver damage. In older adults, who may already be at risk for osteoporosis, excess vitamin A can increase bone loss, making bones more brittle and fragile. This raises the risk of fractures. In fact, some studies have shown that people who consistently take high doses of vitamin A supplements are more likely to experience hip fractures and other bone problems. Where does all this extra vitamin A come from? While it's rare to get too much vitamin A from food alone, as most dietary sources are safe and balanced, supplements can easily push you over the recommended limit. Many multivitamins and hair, skin, and nails supplements contain vitamin A, sometimes in amounts that far exceed what your body needs. Some medications, like certain acne treatments, are also derived from vitamin A and can contribute to toxicity. For most adults, including seniors, the recommended dietary allowance, RDA, for vitamin A is about 700 micrograms, mcg for women, and 900 mcg for men per day. Toxicity can occur at doses as low as 3,000 mcg per day over long periods. If you're concerned about your vitamin intake, it's important to check the labels on your supplements and talk with your healthcare provider. They can help you assess whether you're getting too much and suggest safer alternatives if necessary. Most people can meet their vitamin A needs through a balanced diet that includes leafy green vegetables, carrots, sweet potatoes, and dairy products. Next, let's talk about vitamin D, another fat-soluble vitamin that's crucial for bone health. Vitamin D helps your body absorb calcium, which is vital for keeping bones strong and healthy as we age. It also supports immune function and helps regulate other important processes in the body. Many seniors in the United States are encouraged to take vitamin D supplements, especially if they spend less time outdoors or have limited exposure to sunlight. However, just like vitamin A, it's possible to have too much vitamin D, especially from supplements. Vitamin D toxicity, or hypervitaminosis D, happens when you take doses much higher than the recommended amount over time. The body stores excess vitamin D in fat tissues and the liver, and it doesn't get rid of it quickly. The recommended dietary allowance for most adults is some 600 to 800 international units, IU, per day. But some supplements contain much higher amounts. When you take too much vitamin D, your body absorbs too much calcium from the foods you eat. This leads to a condition known as hypercalcemia, where there is too much calcium in your blood. Symptoms of hypercalcemia include nausea, vomiting, weakness, frequent urination, and confusion. If left untreated, it can cause more serious problems like kidney stones, kidney damage, and abnormal heart rhythms. Some people may also experience bone pain and calcium deposits in the arteries and soft tissues, which can increase the risk of heart disease. It's important to remember that vitamin D toxicity almost always comes from supplements, not food or sunlight. The body regulates how much vitamin D it makes from sunlight, and it's nearly impossible to get too much from diet alone. But with the increasing popularity of high-dose supplements, cases of vitamin D toxicity have become more common, especially among older adults who may be more sensitive to changes in calcium balance. If you're taking vitamin D supplements, it's a good idea to have your blood levels checked regularly, especially if you're taking more than the recommended amount or if you're using multiple supplements that contain vitamin D. Your healthcare provider can help you determine the right dose for your needs, taking into account your age, health conditions, and lifestyle. The third vitamin to watch out for is vitamin E. This vitamin is a powerful antioxidant, which means it helps protect your cells from damage caused by free radicals. Vitamin E is important for immune function, skin health, and other bodily processes. But unlike some other vitamins, high doses of vitamin E can interfere with blood clotting and increase the risk of bleeding, especially in older adults who may be taking blood-thinning medications like warfarin or aspirin. Vitamin E is also fat-soluble, so it can accumulate in the body over time. The recommended dietary allowance for adults is about 15 milligrams mg per day, and most people get enough from a balanced diet that includes nuts, seeds, vegetable oils, and leafy green vegetables. However, some supplements contain much higher doses, sometimes 400 milligrams or more per capsule, which is far beyond what the body needs. Taking high doses of vitamin E supplements has been linked to an increased risk of hemorrhagic stroke, a type of stroke caused by bleeding in the brain. Studies have also found that very high doses of vitamin E may increase the risk of prostate cancer in men and may not provide the expected benefits for heart health. For these reasons, most experts recommend avoiding high-dose vitamin E supplements unless specifically prescribed by your doctor for a medical reason. If you're taking vitamin E supplements, be sure to check with your healthcare provider, especially if you're on medications that affect blood clotting. They can help you weigh the risks and benefits based on your individual health needs. It's important to remember that while vitamins are essential, more is not always better. The best way to get the nutrients you need is through a varied, balanced diet that includes plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Supplements can be helpful in certain situations, such as when you have a diagnosed deficiency or a specific medical condition, but they should be used with care. Many older adults in the United States take multiple supplements, sometimes without realizing how much they're getting. It's easy to lose track if you're taking a multivitamin, a separate calcium or bone health supplement, and perhaps one for your skin or immune system. Each of these might contain overlapping vitamins, and the total dose can add up quickly. This is why it's so important to read labels and talk openly with your healthcare provider about all the supplements and medications you take. Some simple steps can help you stay safe and healthy. First, review all your supplements with your doctor or pharmacist. Bring a list of everything you take, including prescription medications, over-the-counter drugs, vitamins, and herbal remedies. Your healthcare provider can check for potential interactions and make sure you're not taking too much of any one nutrient. Second, focus on getting most of your vitamins from food. Whole foods provide a complex mix of nutrients, fiber, and antioxidants that work together to support your health. They also make it unlikely that you'll get too much of any single vitamin. For example, eating a serving of carrots won't overload you with vitamin A, but taking high-dose supplements might. Third, be cautious with high-dose supplements unless they're recommended by your healthcare provider. If you're told you need extra vitamin D or vitamin B12, for example, ask about the right dose and how long you should take it. Avoid the temptation to double up on supplements in the hope of extra benefits. More is not always better. Fourth, keep an eye out for symptoms that could signal vitamin toxicity, such as unexplained nausea, fatigue, weakness, headaches, changes in vision, or unusual bleeding. If you notice any of these, seek medical advice right away. Lastly, remember that good health is about balance. Vitamins are just one piece of the puzzle. Regular physical activity, managing stress, staying socially connected, and having regular checkups with your healthcare provider are all important for healthy aging. In summary, While vitamins play a vital role in keeping us healthy, it's important to use them wisely. Vitamin A, vitamin D, and vitamin E are essential for health, but taking too much, especially from supplements, can cause serious harm. Excess vitamin A can lead to liver damage, bone loss, and other problems. Too much vitamin D can cause dangerous calcium buildup and kidney problems. High doses of vitamin E can increase the risk of bleeding and stroke. The safest approach is to get your vitamins from a healthy, balanced diet and to use supplements only as needed under the guidance of a healthcare professional. If you have questions or concerns about your vitamin intake, don't hesitate to ask your doctor or pharmacist. They're there to help you make the best choices for your health. Remember, taking care of your health is a lifelong journey. As we age, our bodies change, and our nutritional needs may shift. By staying informed, being mindful of your choices, and working closely with your healthcare team, you can continue to live a vibrant, healthy, and joyful life. Thank you for taking the time to learn about vitamins and how to use them safely. Wishing you good health, happiness, and many more bright days ahead.